One of the big differentiators between our flagship product, the RealActivity Physician Experience Copilot, otherwise known as PEXCO, is our strategic decision to focus on administration and operation. So a very quick story. This was very purposeful. So I remember earlier in my career when the PC was first being introduced to healthcare organizations, the providers in the hospitals, rightly so, were very worried at the time. And I remember hearing doctors using phrases like they wouldn't put a PC in a room with a patient. They would worry that it would scare the patient. And interestingly enough, when we fast forward to where we are today and some of the big announcements that have been made in modern AI over the past 2 years, I started initially hearing some of the same phrases. Folks very worried, rightfully so, just like with the PC way back, rightfully worried about AI safety, responsible AI, the patient safety. And what we realized when we were dealing with this same fear and opportunity back with the PC in I say the early 90s because hospitals were actually one of the last to adopt the PC, if you will. And so one of the things that we did back then is we made a strategic decision to focus on healthcare, on the operations of the administration side. So we just found very quickly that we could implement technology across all the ancillary services, even down to the cafeteria. And so what we did is we went down that path, and then sure enough, as a year or two progressed, the providers became more and more accepting of PCs, and we know the rest of the story. And so we sort of see that same strategy for us. We're using that same strategy now with modern AI. So we made a very strategic decision to take the body of work that we've built with our flagship partner in the United States that's focused on healthcare administration, operation, RVU management, work RVU management, CMS compliance. We can actually produce the cost care reports that are required for CMS and help folks pass audits. So one of the things we do is set you up beautifully to pass third-party audits for CMS. So what we decided to do with modern AI is to take that body of work and experience that we have, and then we essentially took the AI and just put it right on top of it. And so I actually recommend this strategy for other folks as well in healthcare organizations. I think oftentimes we focus on building, the next new thing. And while that's super important, right? We all want zeros and ones and true innovation. But I think oftentimes what you can do is you can take something that you already have and then add modern AI on top of it and then make it exponentially better. And so that's essentially, I think that's a big differentiator for us because, again, it's that proven experience. On our staff, we literally have hundreds of years of healthcare experience. Myself personally, as our senior engineer and chief of AI, I have about 30 years of experience. I'm dating myself now with some of these issues, and we've done a lot on the clinical side too. I'll talk about that later. But when it comes to our physician experience copilot, I think what separates us, is our experience in that space and proven execution with an existing platform. And again, we're just taking the AI and making it 10 times better. It's not like we're inventing anything new. I think one of the things that we're doing that's really important when it comes to implementation of modern AI in healthcare organizations is we are heavily focused on keeping the provider in the loop. So we do this through something called intelligent attestations. Intelligent attestations are core to our flagship product, our PEXCO Copilot, the Physician Experience Copilot. And essentially what we do is we've managed to build out a platform that allows us to very quickly and accurately get attestations from the providers throughout the healthcare system. So for example, we sort of know what providers are doing, meaning like we could go to the ERP, we could go to the electronic health record, we could go to the grant system, we could go to the contract system. We pull all that stuff together, and then the ERP system is important, right? We need to be able to see their roles and the departments they're working for, et cetera, et cetera. But once we aggregate that data, we can get a fairly good sense. We call it the activities of the hospital. That's the term, the name of our company, RealActivity. And I would submit that over the past decade, that's really what we've just become experts at. It's the ability to capture the true activity across the entire hospital system for all providers. Now, once you have that data set, and keep in mind, this is something we've been working on for 10 years. And so you can imagine as we've been building that data set, and now the first wave of AI, and now we've got our second wave of AI, what I coined the term modern AI, if you will. What we can do is we can use that data to do all sorts of stuff and to answer really important questions for the hospital. And but most importantly, we don't just take the data and start running it with using AI and producing the reports for CMS audits, etc. What we do actually is we use our intelligent attestation engine, and every provider gets a quick email. They've got a link, and essentially we show them what we think they're doing, and we do this as a percentage of their time. We don't do it using hours. We've learned never to ask providers about their hours or to count their hours. And so essentially we ask them, did you spend 5% of your time running your department? Did you spend 3% of your time working on this research grant? Did you spend 2% on this grant? Did you spend X amount of time teaching or admin work? And then essentially what we do is we subtract that from their FTE, and that gives us the true clinical FTE across the organization. But most importantly, it's been attested to. The provider has had a chance to see it before it hits any AI model, before it's used in any workflow optimization for the organization. And we just think this is really, really important to keep the provider in the loop. We think about this all the time on the clinical side, right? When we're looking at implementing AI for radiology, et cetera, we talk about keeping the provider in the loop. But this is overlooked on the operations side, and it's something that we have proven experience doing. Again, I think we've done over 1 million attestations on our intelligent attest. We now call it our intelligent attestation engine. Over 1 million attestations. And so for us, we view this as a real differentiator in what we're doing, not only in healthcare administration and operations, but to some really core metrics that matter to leadership, right? Around WRVUs, again, the true clinical FTE, mapping that back to compliance reporting for CMS, and just giving leadership that complete top-down view, one version of the truth of the true clinical FTE, which is, as you know, your billable bottom line, right? So we're really proud of that work, and that's definitely a differentiator for us.